This is how it's done. Democrats in the House of Representatives going on the offense and brutally cross-examining RFK Jr., who looked stunned as he showed up to give testimony and to spew lies. Democrats were ready for it with the receipts, and Democrat after Democrat cross-examining RFK Jr. and exposing the fraud, the con artist, the charlatan that he truly is. Let's take a look at Democratic Congressmember Harder during his cross-examination of RFK Jr. Cry harder, RFK Jr. Yes, pun intended. Play this clip.
This mercury rule. This is your administration making this decision. Are you critical of it? Why have you stayed silent on this?
You should call Lee Zeldin here and ask him about those. That's not in my. I have a $2.3 trillion agency. I've got
Secretary, you had in your testimony. You wrote an entire report.
I was not part of the hearings. I was not part of that decision. I'm not going to comment on it because I don't know anything about it.
It sounds like pretty convenient amnesia to me because you wrote a report where you talked about the damage of toxic air and water pollution.
Mercury is absolutely, it's the most powerful neurotoxin that we know of in the universe.
So why are you working for an administration that is doubling the amount of mercury pollution in our air and water?
I am running HHS and I'm ending the chronic disease epidemic.
I think it sounds like
which is what President Trump wants. And I'm not going to comment on that because I don't know anything about it.
Well, I think that's very convenient for you, and it shows a significant degree of cowardice. It's not just mercury. President Trump in July 2025 granted 50 chemical plants.
Why don't you ask me something that I'm in charge of instead of other things?
Are you not in charge of healthcare and human services?
Yeah, HHS.
And you wrote a report about how we want to make sure that our kids.
What you're asking me about is not a decision that's being made by my agency. Why don't you ask me about something, and I won't ask you about something that's happening in the United States Senate.
Sir, I'm happy to talk about what's going on in the United States Senate. I'd be happy to talk about the damages that mercury pollution did. I think it's pretty disturbing.
I'm telling you what I know, which is mercury is a toxin. We should be minimizing the exposures to that in the environment. I don't know anything about the particular. Running this agency is a big job, and it's pretty consuming.
Well,
so I don't get into what the other agencies are doing.
I think this sounds like a pretty simple story.
Why don't you ask me something that's happening in my agency?
I think if
you ask me about a decision that I've made.
You wrote a report. You wrote a report talking about what we need to do to make our kids healthy.
I've admitted it. You're talking in circles. I've said.
I think it's pretty disturbing to me that you don't want to talk about a doubling of mercury pollution.
I don't want to talk about.
You've spent a career about this.
I don't want to talk about a regulation or a policy that I don't know anything about.
Then you had Democratic Congresswoman Sewell. She points out, isn't it true that in 2024, you said some horrific things on a podcast about black children? To which RFK Jr. is like, I never said such things. It's like, you did. We have the actual audio of you saying the thing. I didn't say it. You did. This is actually what you said. Watch this. Let's play this clip.
In a 2024 podcast interview, you suggested that Black children on ADHD medication should be reparented. You said every Black kid is now just standardly put on Adderall, SSRI, benzos, which are known to induce violence, and that those children are going to have to go somewhere to get reparented. There is a lot to unpack in that comment. I know that you've already answered several of the questions I was going to ask, and so I'm just going to rephrase them. Mr. Secretary, you've already admitted that you are not board certified physician, and you've already admitted that you did not go to medical school. Have you ever reparented, or parented, I should say, a Black child?
I don't even know what that phrase means, and I doubt that
a yes or no answer.
I doubt that I said that phrase. No,
absolutely.
I'm not going to answer something that I didn't say.
You absolutely said it.
Oh, I'd like to hear the recording.
So to be clear,
it doesn't make any sense. I don't even know what it means.
I don't either. That's why I'm asking.
And by the way,
So to be
Of
clear, you're not a
26.
doctor, you have no medical degree, and you have no formal medical training.
As
You
have,
have never
as have,
parented a black
as have
child. And yet you
24
are
of the
suggesting
26
that
HHS
government-
secretaries
Mr.
have not had
Secretary,
medical
This is my
degrees.
time. And I say to the chairman, I want to reclaim my time. So you are not a doctor, have no formal medical training, and you've never parented a black child, and yet you are suggesting that the federal government should take black children away from their families and reparent them and send them off to some wellness farm instead of providing them with evidence-based
You're just
medical
making stuff up.
I am absolutely not making this up. Mr. Secretary, in your opinion, what factors should the federal government consider when reparenting a black child who has been on ADHD or ADD?
I don't even know what
rhetorical,
you're
sir.
talking about, Congressman.
I
don't know what you're talking about. I don't know what
deficit
reparenting
disorder.
even means.
I don't either, but you said that.
I did not
Mr.
say that.
Secretary, for black families in the United States, the issue of family separation is not new. Our nation has a long and painful history of separating black children.
Now, I'll show you what he really said in just a moment, but I want to show you Democratic Congressmember Pocan cross-examining RFK Jr. Let's play it.
I really want to ask about is something I think much of what you're doing around healthy foods and health is right on, dead on with the MAHA movement. But there's other things that I got to admit honestly confused me. We won't talk vaccines at all this year, but I do want to talk about glyphosate.
About glyphosate?
Yeah, this is something you've got a record on. You said it was probably a carcinogen. You've talked about one of your tweets, likely one of the most chronic disease epidemic, most widely used here in Europe. Shockingly, much of our exposure comes as its use as on and on. You said your USDA, when you were running for president, will ban that practice. And Casey Means, who you just brought up, also talked about grave concerns and about it as a carcinogenic. And you said, I believe it causes cancer. Those are all your words. And yet the White House came and decided they want to expand the production of this, and you were supportive. And I'm just trying to understand, did the evidence change between now and then? And again, briefly, if you could, why shift on that recommendation?
No, I had grave reservations about the president's executive order. I understand why he did it. The executive order right now, there's a problem in this country the president didn't create. 97% of corn is glyphosate.
You can do it in 60 seconds because I got one more.
98% of soy is glyphosate dependent. 100% of glyphosate is made in China.
So do you still think it's carcinogenic? Maybe that's easier.
Oh, yeah.
Yeah. So
Yeah.
I would like to make sure that MAHA does not become MAHWICA, which is Make America Healthy when it's convenient again, right? And this is kind of out of convenience, right? If you know it's
It's a
carcinogenic.
national security issue because China can shut off our food supply overnight.
Would you right now eat something with glyphosate on it?
Would I?
Yeah. You've got a reputation for eating interesting things. Would you eat
not by choice?
right? Yeah. I mean, I wish, MAHA stands for something. And I actually like a lot of what MAHA stands for in eating healthier foods. And it's an integral part of health. But if we're not consistent on it for whatever reason, we don't really have a MAHA movement. I just want to express that concern.
The president has put more money into developing alternatives for glyphosate than any other president.
Gotcha. But right now, you're saying it's okay to have a known carcinogenic.
I don't think it's
that's
okay.
my concern.
I think we inherited a problem in this country.
Gotcha. I would just like one more subject if I could. I'm trying not to be rude. I really appreciate it.
Now I want to show you Democratic Congresswoman DeLauro. Here she is cross-examining RFK Jr. Let's play it.
I just have, I'm having, said what I said and what your view is on raw milk, unpasteurized milk. And the FDA's website says raw milk, unpasteurized milk can harbor dangerous germs that can pose serious health risks to you and your family. You have your own personal views about raw milk. They cannot be part of a health protocol.
That the raw milk is not regulated by the federal government. Congresswoman DeLauro.
Unpasteurized milk.
Yeah, it's regulated by the states. It's not regulated by us.
Mm-hmm. Well, they can
legalize
it within their borders.
We don't regulate it. FDA does not regulate it. It's
Well,
regulated by
right.
the
It can't be
states.
circulated across
Some states
state
allow
lines.
it, some states do not. It's up to the state. It's not up to us.
Well, you are the head of the Health and Human Services. If raw milk has the ability to put 9 people into the hospital, serious kidney disease, more than half the cases involving children 3 years and younger, you are the Secretary of Health and Human Services. Is there not some moral responsibility or compunction to say, don't drink raw milk? Don't do that because it's unpasteurized and it can cause you serious harm to your health. Is that not you view as your responsibility?
You just pointed out that processed cheese can also contain contaminants. Every product can contain contaminents. What we do is we inform the public.
Look,
we let people make a
the chairman
choice.
is
There's
gaveling
also-
me down, and just to say this, if I were the head of HHS, I would, by God, say, don't take raw milk. It is dangerous to your health. And if you can't say that, well, maybe there's some other conclusions that can be drawn. Thank you, Mr. Chairman.
Next up, you have Democratic Congress member Swazi cross-examining RFK Jr. Let's play it.
Democrats versus Republicans, Mr. Kennedy. I don't want to do that. I want to be bipartisan. I want to work together. I've applauded you on some of the things that you're doing that are good. But how does it square that he's increasing the defense budget by $500 billion and cutting money for NIH and CDC? The budget, you talk about the budget and the things he's inherited. He's increased the deficit by more than any administration in the history of America as part of the big, beautiful bill. That's not something he inherited.
This president has done more to protect public health than any president in history. He's the first one. You guys are the ones that gave us the chronic disease epidemic. We're the unhealthiest population on the face of the earth.
Did that all happen in the past 4 years of the Biden administration? It's you guys?
It happened.
It was the Kennedy administration. It was the Clinton administration.
You've been a politician your entire life.
Yes. And you've been involved in public life your whole life as well.
Right. Well, I'm not in elected office.
You've tried to run for elected office. You decided not to do it on many occasions. I followed you very closely, Bobby.
I've never ran for anything.
I know you decided not to at the last minute every time. I followed you
What does that have to do with it?
You're bringing up the politics,
All right.
not me.
Time is over.
Next up, Democratic Congress member Horsford cross-examining. Let's play this clip.
Have you aligned your goals dealing with the reforms to the EPA protections and how that is making people sicker, not healthier? That was my question.
Yeah, I could not answer those questions because it's
You
not
can't
in my,
answer the question as the
not
secretary.
it's not my agency.
You don't coordinate with the EPA, Mr. Secretary? Your department is not involved with rolling back protections that would increase exposure to heavy materials, even though it affects people's health? Is that what you're telling me? You don't coordinate?
I say, calm down, Congressman.
Don't tell me look, healthcare is personal
Okay.
to my constituents like Deja
Your
and
time
Richard.
is over.
Do not tell me to calm down. Healthcare is real. And if you can't answer basic questions, then maybe come prepared next time.
I'm answering the question. You don't give me the chance to answer. You haven't given me a chance to
You
answer.
said you
I'm happy
didn't-
to answer your
you said
question.
you
And
weren't-
cut me off when I started to answer.
You said you
You started screaming
not
at me.
consult-
Okay, the
with
time is
EPA.
expired. We're going to move on. Mr.
People
Yacob.
scream when they don't have much to say.
You obviously don't have anything to say because you can't even uphold what it is you're
Say it.
doing to
Mr.
reduce
Horsford,
cost
your 2
and
minutes
coverage.
over.
Give me a chance to answer the question.
Finally, you have Madeline Dean, Congresswoman Dean, cross-examine RFK Jr. He did not handle it well. Let's play this clip.
Mr. Secretary, how many members of the Advisory Committee on Immunization Practices did you replace when you came in?
Well, I fired all 17 members.
That's correct. You fired all of them.
Yeah,
All of the vaccine board.
the entire corrupt vaccine board.
Okay, thanks. You've decided they were corrupt. And apparently what their practices were, what their recommendations were keeping us healthier, children healthier,
Well,
children alive.
You're not
You
going to let
replace
me
them
reply.
with-
You will not let me reply because you do not dare to talk to me about what you just talked about measles. You do not have the courage to allow me to reply.
I told you the numbers. You know the numbers. I would think that would concern
That
you as
doesn't tell-
secretary. That would,
You're implying that is because of a drop in vaccination rate.
there is a
80% of those
connection.
numbers are people who are over 5. They had nothing to do with me.
That there is.
Vaccination rates dropped
there
after
is-
COVID because of mismanagement.
I'll reclaim my time, Mr. Secretary. Thank you. And you replaced all 17 members with people who lack the expertise required to make evidence-based recommendations.
Wrong. Absolutely,
Well, it's true.
completely, utterly wrong.
Okay.
Then there was more powerful cross-examination of RFK Jr. by Congresswoman Madeleine Dean right here. Play this clip.
Did you recommend cutting $261 million from SAMHSA's Center for Substance Abuse Prevention? Yes or no?
We didn't cut that money.
Have you read your budget? Have you read your budget proposal
For this year,
for this year? And we could talk about SAMHSA before, but for this year, did you read your budget proposal?
I thought you were talking about another issue.
Okay. You've cut SAMHSA.
But we've also elsewhere
You're cutting
increased
SAMHSA. Am I right? You're cutting
dramatically.
SAMHSA.
We've dramatically
no?
increased our investment in addiction elsewhere.
That is actually not true. That is seriously not true. And that's why we have to have these budget hearings and you have to come in knowing what your budget request was. I have read the budget and your testimony. You state in your testimony that AHA, I'm not sure that acronym, but AHA, will focus on high impact priority areas, including mental health. Did you recommend cutting $1.3 billion from the Center for Mental Health? $1.3 billion cut in your budget.
I think that's the proposal.
Okay, you're comfortable with that.
That's right. He doesn't even know what his budget is. More from Congresswoman Dean. Great cross-exam. Let's play it.
And you also propose consolidating substance use and mental health block grants along with state opioid response funding, just as we're finally making some progress. You did not increase the overall funding. You're trying to cut all of these things. In my neck of the appropriations woods, we call that kind of block granting shifting and shafting. We move all of you into one fund of money. We don't give you any more. In fact, we cut a whole lot, and good luck finding your resources.
Yeah, we've
I
created
asked you
new
to
programs.
Programs because the other ones were so lousy. SAMHSA wasn't.
They weren't.
SAMHSA was a bad program. I guess
can
that's why you
explain to
cut it earlier this year.
I'm happy to
entirely.
explain why, Congresswoman.
Well, let me just finish with you cut it entirely earlier this year, sending 2,800, I think, notices of grant cancellations, which the administration had to reverse in a matter of a day. What kind of incompetent decision-making is that when lives are at risk?
Termination notices went out in SAMHSA, and I reversed them as soon as I found out about it, within 24 hours.
Yes, it was a crazed mistake.
You know what? As a bonus clip, I'd like to show Democratic Congresswoman Linda Sanchez bringing out the receipts that while RFK Jr. is shutting down hospitals and taking away life-saving medicine from people, he's out there using taxpayer dollars, drinking milk while shirtless in a hot tub with Kid Rock and funding ad campaigns on that. Let's play this clip.
Health messaging campaign on the importance of vaccines could have stopped this surge of measles cases as it had in past outbreaks. But I was appalled to learn that the CDC suspended public health messaging on vaccines last February. It ended a successful flu vaccine campaign as well. My question is, did President Trump approve your decision to end CDC's pro-vaccine public messaging campaign?
You got a lot of misinformation there, first of all.
No, I'm asking you a question. I
Let me
appreciate a
respond
response
to the
question.
misstatements that you've made.
No, you have other opportunities. I have limited time.
I only have,
Please
you're
answer my
the only
question.
opportunity I have
Did
to
President Trump approve
respond.
your decision to end CDC's pro-vaccine public messaging?
Allow me to respond to a lot of the misinformation.
No,
that
answer
you
my
just-
question, please, sir. I have limited time.
There's a global measles epidemic. We've done better in preventing
There's
it than any country
there
in
is
the world.
no country that has seen a bigger percentage increase.
That's not
than
true.
this.
Mexico has 3 times our measles, and they have
President
1/8 of our
Trump
population.
approve your decision to end the CDC's pro-vaccine public messaging?
Canada has double
Was
the
that a
measles, and
decision
they
that
have
was made
1/3
by
of
Trump?
1/8 of our
Did
population.
he approve that?
We've
and
done better at preventing measles than any country
Did
in the world.
President Trump approve your decision to end the CDC's pro-vaccine public messaging campaign?
We've done better at preventing
That's not
measles
answering my question.
and ending
sir.
the epidemic
That is
than
not
any
answering my
country
question. And I
in the
think you don't
world.
want to answer the question because I think you know
I want to
that
respond to
you are
your
making
misinformation.
terrible decisions that impact very, very real lives, especially the lives of children. Now, one thing that I find incredible is that you suspended this pro-vaccine messaging campaign, but somehow you're spending taxpayer dollars to drink milk shirtless in a hot tub with Kid Rock. And somehow you think that's a better public health message
Your time is
than
expired
informing
by a
the
minute.
public about the importance of vaccines?
Gentlelady's
Really?
time is expired.
Really?
Oh, that was good. So I'll show you one more clip right here of Congresswoman Sanchez. Let's play it.
The measles outbreak in Texas killed an unvaccinated 6-year-old, the first such death in a decade. So simple yes or no question. It's not that we don't want to let you answer. It's that we all have limited time and you have plenty of time to answer questions and you had plenty of time to give testimony at the beginning. So simple yes or no answer will do here. Do you agree with the majority of doctors that the measles vaccine could have saved that child's life in Texas?
It's possible, certainly.
Okay, thank you.
Now let me just bring out the receipts for you, just so you can see RFK Jr. saying exactly what the Congresswoman said. He said, play this clip.
Can go for free. Any of them who is dependent on drugs, either legal drugs or illegal drugs, psychiatric drugs, which every black kid is now just standard put on Adderall, SSRIs, benzos, which are known to induce violence. And those kids are going to have a chance to go somewhere and get reparented, to live in a community where there'll be no cell phones, no screens. You'll actually have to talk to people. And the model for this is a community that I had direct contact with because a family member of mine went there. And it's called San Padrigano's in Italy.
And then the folks over at TMZ had an important question to RFK Jr. after it was reported that he saw a dead raccoon on a vacation and decided to cut off the raccoon's penis and bring it around with him during the vacation and study it and sleep with it during the vacation. Here, play this clip.
Secretary, what did you do with the raccoon's dead penis? Where is it now?
That's the Trump regime for you. That's the Trump regime for you. Hit subscribe. Let's get to 7 million subscribers. Thanks for watching.
Love this video? Support independent media and unlock exclusive content, ad-free videos, and custom emojis by becoming a paid member of our YouTube channel today. You can also gift memberships to others. Let's keep growing together.